We don't know his exact injury. Let's assume a straightforward fracture dislocation. A clean break, let's just say it's his medial malleolus, which is a fragment of bone off the inside of his ankle that breaks cleanly, that you can place screws in, and it just dislocates and comes back in. No cartilage fragments, no damaged cartilage in the sense that there's no osteochondral injury. Okay, so the best case scenario with a fracture dislocation, you line it up, you stabilize the medial malleolus with screws, and sometimes you need a plate depending on the angle. And here's a great example. If it's oblique, it can shear off. If it's lined up perpendicular, then you can just put screws across. You may or may not need a buttress plate to prevent it from shearing off, just based on the biomechanics and the physics of the fracture. Now, bone in the ankle, 6 to 8 weeks, maybe 2 months, 3 months if there's delay. There's other factors. I'm not saying that these are factors in Warner's case, but we're talking about, is he taking nicotine or any other, maybe he has other medications. Is there anything that could delay fracture healing? Does he start walking on it before he's allowed to? Those can affect fracture healing. So assuming 6 to 8 weeks for the bone to heal, let's assume he has a ligament stretch without a disruption of the deltoid or the lateral ligaments. Because typically when you have a break on one side, the ligaments will stay together, the fracture breaks. The energy goes through the fracture. So the other side may have ligament disruption. So he may or may not need ligament repair on one side versus the other, depending. We're talking about a medial malleolus, so he may have ligament disruption on the other side or not. And when that happens, the tendons could fall out of alignment or in alignment. You could affect the peritoneum, but typically the tendons don't rupture or tear or disrupt. They can. The peroneal brevis is well known for having a split peroneal brevis. You can have the peroneus longus affected. The peritoneum, the sheath, can be affected. There's lots of different things that can happen, but assuming the best case scenario, a clean break of the, let's just say medial malleolus, line it up, screws, heal. He's going to go through rehab. He's going to start strengthening. And, this could be anywhere from 4 to 6 months or longer, depending on his recovery.